Hi everybody, I'm Belinda Bolsenbroek and welcome home. I'm so sorry we're a little bit late for our live event. We had some technical issues, so we've had to swap everything around and do something a little bit in hand. So excuse me for the film if it gets a little wonky at times, but I hope that everybody can still follow and hope that this is the first of many where I'll be able to take you into the arena and show a little bit of the work that we do. So this is Calippo. He's a Lusitano stallion, and I'm going to show you a little bit of work in hand with him, just a normal session that we are taking with him at the moment. He is, well, actually what I would say is the one reason why I love the opportunity to trial out if we can do some live events is to really show you the work for helping horses remain sound, also become sound if they've had an accident. We do a lot of rehabilitation here at the Academy, and that we can show you the benefits of the work in hand. Now, normally, if I do in-hand work, I would use Cavesson. Preferably, I choose the softest variety of Cavesson, just a leather nose strap with some rings on it, and not work per se on the halter. But Calippo had a pretty significant paddock injury about 6-7 weeks ago. As you can see, when my hand goes up towards his temple, he's still a little bit sore. He decided to play Houdini one night and got out and jumped over a couple of fences, hung himself up on top of a gate, and fought with another stallion that was in the other paddock that he thought he should pay a visit. And he got pretty well beaten up while he hung helplessly on the fence. So yes, that was you. So we'll go over the injuries quickly, and I'll show you what we're doing at the moment to help him release some of the restrictions he's got, and also where we're going with the exercises. Now, there's a whole variety of exercises that we can choose with our in-hand work. Basically, each exercise of dressage has a purpose. If it is the circle, if it is the laterals like a shoulder in or a quarters in, and also the exercises of the collected work like piaffe, pirouettes, passage, and all the other high school movements, the airs above ground. Every exercise has a way to enhance the strength, the agility, the flexibility, the balance of the horse, and for me everything comes back to the healthy functioning of joints and of the entire soft tissue system all the way to the internals. So we will not be showing much fancy things today at all. We'll leave that for another day. We're just going to work on release and relaxation and use some very basic exercises for that. I might show you a little bit of some little collection steps and how I use them for some particular releases in Calippo, just because he is educated and we can show those things, but obviously I wouldn't do that with a youngster or with a horse that's not ready for those kind of things. So let's introduce him properly, or let's introduce the injuries for a moment. It's okay. As you can see, Calippo's yawning quite a little bit still. He's a little bit fragile also in his nervous system because he's got a lot of diaphragm restrictions. He injured his ribs by hanging on the gate and also being beaten up. And I don't know if you can see it well on the camera, but if you look at his you can see all sorts of bite marks still on his body, and where the hoof imprints have also gotten him. He has a fracture on his facial crest, so we have a little bit of bone still here, and we don't know if it's fractured, but he has had lots of swelling through the left. He did damage his teeth a little bit as well. They've got quite chipped, and he's just had our excellent dentist come by and help him out after most of the swelling has gone, and also to check out to see if anything else is going on deeper in the mouth, and if there's any serious issues on his facial fractures that he's got. So we've got some sacral and pelvic issues at the moment, but also largely due to the pain in his ribs and his problems breathing. And I would like to point that out. At the moment, you can see that we have very shallow breathing, and there's no deep releases. So that's one of the things I will work on most. I will start to use, at times I use a bit when he's in a really quiet mindset, but because we were mucking around with the cameras and the setups for quite a little bit, I decided to take it out. We just have a soft bomber bit that is designed to really fit his mouth, and it helps him actually to sometimes chew and release when I feel he's ready for those TMJ and hyoid releases. But when there's too much compression and too much anxiety coming up, then we want to take it out and just work softly on a halter. And I'll turn him around, but we can see that there's quite a little bit of compensation happening in his body. We've got tight versus weak structures of muscles, and I really want to point out the tabletop structure of his rib cage and his back. That doesn't look all too fancy. He doesn't normally have those divots in his back. Those are due to the enormous tightness through the, particularly the lumborum caudal serrate structure, as he has so much trouble with his ribs and breathing into, and with the releases of his diaphragm. We can also see quite a bit of restriction at the top of the sternum, and as you can see, he likes to chew things at the moment quite a little bit and be fidgety because he's had quite a lot of issues around his pole and tension in his hyoid. Now you can see also why he got a little bit in trouble on this side. We still have a lot of marks of where he got grabbed by the neck, and we have some really good boot marks. So he got quite banged up, and we got quite a little bit of injury on his C4 and C5, which also causes the nerve compression of the chest. I should mention lastly that he's had an issue on the right shoulder as well. He's not lame anymore, but you'll see that there's an offset and that there's quite a lot of stiffness happening. Now, that's quite a lot going on in the body, and my first pick of working with him is that, well, of course, because it's a rehab plan, we need to have an understanding of the structure of exercises, what their purposes are, and then we have to assess what's happening in the arena every day. So the first thing that I will do is just to take him for a little walk and just to start to wander around and ask him to just relax and watch him, see if he feels in any way a little unsettled. There we got a nice sigh. He's releasing as he's just starting to move a little bit. And all I need to do is just wander around, because we're already working a little bit from side to side, which means I'm already working a little bit on making some rib movements happening. And I just do that in the beginning to assess. Now, the first thing I noticed is that he likes to keep me here at the moment on his left side. Normally we would swap over and he's letting me in on his right side. But when he's a little tight and tense in that shoulder, there's, as you could see, a lot of injury on that side. We can also find the horse being a little protective about that. As you can see, when I come obviously to the right side and help a little bit with the whip aid, he goes, no, why don't you just stay on the right side? So I'm very lucky because I have a beautiful line of mirrors there, so I don't have to be so much in his face at the moment as I start. And I want him to feel that it's a very safe space to just relax and walk. You can go over that way, baby. There. And oh, actually, I should say that. Yes, sorry about that. Can everybody hear me? Can you put a thumb up if you actually have good audio? It would be a shame if we don't. Just everybody let us know if you can hear us so that I know the audio is working. Yeah, good. All right, wonderful. You're a very clever boy. Well done. So I feel that we have an okay situation. He is definitely very stiff, as he has been. He's still recovering from injury, and we will get a lot of tight tightness happening. He's still using his own compensation patterns of movement when he's in the paddock. Good boy. That's very nice of you. Yeah. Good. Let's just have a look. Come. It's okay. Yeah. Good. There. So the first thing I'll then start to do is take position number 1 of our in-hand training, and that's walking backwards. I can there align myself really well with the inside shoulder of the horse, and I can see his movement. Now, as you can see, he's twisting a little bit in his poll, and it's not quite straight. And I think it's very important to be mindful when you're working on rehabilitation horses, is to not work through something that is holding tension too quickly. Because as you can see, now he just licked and chewed a little bit, he shook his ears, and he's starting to give a little yawn, and he's saying, all right, if you are just soft and quiet, I can relax, and he will take the position by himself. And because he's following me, and we're starting to use what I call mirroring. So in my mirroring, walking backwards, I focus on just his footfall. Start at the front feet, working through to the back feet, and just see how he's weight bearing on each foot. And I try to guide him in my body position very subtly. This is a very sensitive horse, and he has still got a lot of pain responses, so we need to be really quiet and calm. Yeah, good boy. And work on moving himself a little bit to that left front foot so that I can get some space through the right shoulder. Good boy. Now, as you noticed as well, I stayed now a little bit into the right rein. And the reason for that is that I want him to get comfortable on his right hind leg, on his right hip. And if you're watching his footfall, you can see that he still has an uncomfortable position of the sacrum into his lumbar and also into those ribs, because he's moving over his outside hoof. He's falling over his lateral wall of the foot and moving close under himself, protecting the mechanics of movement of the lifting, the rise of the lumbar. Good boy, Ho. Good job. I take lots of breaks in our session so that we have the opportunity to just stand and feel the body for a moment, for him to calm, for him to find that it's pleasant, give him a little goodie. Let him have a look around at all of you. There. And then I assess for a moment, what can I see in the front feet that has changed opposed to what he was doing before. So we have a nice square stand at the moment, and so we've got some really beautiful releases. Also, you can see his eye is a lot softer, and he feels a lot softer in the whole facial structure. He's starting to get a little softer in the poll. Now, his left rotation is still very far off normal in his poll area in C2 and 3. And that's where we will go now, is to see if we can bring that rotation. Those rotations are the ability for the poll to move is very much related to all of the facial structure of the TMJ, of the hyoid apparatus of movement, and until the structure heals in its entire, until all of the connected muscles and the connected structures are functioning well again, you will always feel the little bit of rotations. So we don't force them to become straight, but it is our intention to help him through the balance of movement to become straight. So let's try the opposite circle. Now immediately you could see and feel a little hesitation there, going, oh, not that side, I don't really like that side so much right now. And you can see the hesitation when I want to bring my hand up. That's only because I don't have a cavesson, so I will put it a little bit down, but I'm never putting pressure on, just to place his nose gently. Good boy. That's very nice. Well done. Just relax. Good. And I don't have weight on it. I just guide it because I don't want him to feel that he's getting uncomfortable, like over there, I'll just take it away again. Come. No, no, no. It's okay. Yeah. And if I feel it is too comfortable, there's too much movement away from where I want to go, I'll take it down. I'll take it away. Let's just wait. Good boy. Now let's have a look at that right hip that's completely fallen away from my balance. And as we can also see already, we have the tension through this left lumbar very tightly pulled upwards and a big compression through the ribs on this side. He got pretty banged up over his ribs, and this side is still very tender. So I would like to release through the transverse processes through the area of the lumbar into the last ribs and actually create some space through these ribs and let them come down into a normal place. There you go, that was nice. I first have to wait for relaxation. Good boy. I'll take him to the wall. Good boy. And we can have a little play with quarters in, where I can get that release through the ribs, but as you can see, we get lots of spasm over the shoulders, so we don't want to stay in it too long. Good boy. Oh. Good boy. Now the reason I use the quarters in rather than a shoulder in is because I'm looking for release of the rib and moving into the space of the rib so that I can actually get the chest to come out. We have the restrictions through the right shoulder and to the right first ribs, and so it is the natural placement that would help with the movement to create the releases into the correct direction. If I would use a side movement like a shoulder in or on the circle sideways, as you can see, we're just stepping sideways. Not really anything happens there other than the horse yielding to an aid, and it doesn't do anything purposeful. As you can see, he also immediately lost focus and wants to start doing other things, which is because it's an overwhelming position to take. So we don't want to use that at this point. There's a purpose for those exercises. If we don't have this kind of rib problems, then we would actually start with the exercise of shoulder in. It's okay, boy. It's okay. Yeah. Good. No, let's try. Let's try. Good. There we go. Well done. Well done. Now also the travers, the quarters in or the haunches in, it's all the same thing. We are looking for the small changes and not for just moving sideways and stepping hugely under, because what will happen in such a case is that we just get compression of shoulders pushing into the rib cage. So these things in the work in hand are quite refined, and in rehab in particular they become very precise on what is it that you actually need and what is it that you actually need to avoid. Let's try it on this side. Good boy. That's a lot more anxious there. You're okay. There we go. Good boy. Now nipping is a sign of discomfort, of anxiety, or of overwhelm. So if you're working in hand and your horse is nipping you, you're probably in the way. And you should get yourself a little bit better centered. Or, good boy. Nice. Or, in the case of this horse, in the case of Calippo, we might just be pushing into the areas that he doesn't feel so secure. That doesn't mean I need to avoid it, but I know exactly where I want to go with this, so I also know where I can push and where I shouldn't push. So here I can use a little bit more angle. Good boy. You could just see that little air shake, which is a pole release, where we're trying to get into that left side. Yeah, good boy. Come. No, don't have to. There. Good. Let's try that again. No. Good. Good boy. Good. And hold. Good. There we go. That looks good. Well done. You're very clever. So I really liked what he just did with his shoulder there, because he put it back in a correct center and he left his shoulder quite open and straight, and that's been a real issue. I'm not going to point it out because he's still very sensitive around the nervous system of the over the scapula, I should say, and through the base of his neck. So what you can see is that the fascia is a little different here. There's quite a lot of whirly hair that shows that there's a different, it's not laying nice and flat and smooth, and this is all like an area of restriction and some dysfunction underneath that's still a little bit locked up. Now you can also see that behind the scapula we have a big pocket, and that's also your indication of a restriction that should be nice and smooth. So as I said, he's still a little anxious when I want to put the whip over, and we're just going to play with that a little bit, because I'm going to ask him to just move through the chest just a little and look for some releases through his shoulders. There. Good. That's it. No. Yeah. Good. Yeah, you try it. You can do it. Yeah. So I'm using the whip on the... Yeah, he's clever. Now it's completely crooked, but he opened the shoulder, so the first reward is in the response being brave enough to try and step through it. What I mean with crooked is that he quickly threw his neck to the opposite direction. These are important moments, because he brought the shoulder forward and his foot forward, and we can see now, if you look at his eye, he's really feeling that through his body, and he's taking a moment to process the changes in the body. And that is what we learn with the in-hand, using it in a form of therapy, is that you can really heal your horse through movement, but you have to be aware that what you're creating and what it does to the horse, and be very attuned to what the horse is telling you and what it needs. Like there, good boy, you're very clever. So what I will do next is to move him a little backwards, and I'm very careful with this exercise, because backing up a horse can create huge stresses on the horse. There we go, good boy, there. And I would only use it in very rare cases, in this case, because of the connection of his thoracic into his lumbar and the rib restrictions and damage that he's got there. Good boy. And just moving him a little bit backwards in himself at that moment, bringing him into his pelvis, is creating the release through the rib cage, and therefore also the immediate response to yawn as he's releasing through the base of the neck. Good boy. There. No, a little more. So I don't want his front feet to stay on the ground at all. I just want him to move. Good boy. And as I said before, I only use backwards stepping if it is a particular case of releases of rehab, or if the horse is already well balanced and centered. Walking lots backwards or moving the horse a lot backwards can cause excessive stress on the joints of the hindquarters, so we should be really mindful of that. It's similar to doing collection too early. And whoa, good boy, nice work. And walking backwards does not lift the chest, it actually just drops and compresses the thoracic. If a horse walks backwards, they push into the caudal neck when they're not yet capable of lifting, that is. So we should be really careful with that one. That's very clever of you. Well done. Yes, he's very clever. Let's go again. Good boy. No biting. No. There. So normally we wouldn't have any. Oh, that's okay. Let's pick that up a little bit. Good boy. There we go. Nice work. I'm just going to take a little wander. Good job. Normally we wouldn't have any of those nips, also not in his form of rehab, but you're quite close to the camera, and there's someone behind that camera, and that changes the situation a little bit for him, because he's not that keen on, he's got a little bit of stranger danger this horse, in this moment. And that is normal for a horse that has to deal with body restrictions or discomfort. When you have an accident in a horse like this, he is a stallion, he's already a highly sensitive horse, has had lots of travel, to go through, and he's had quite a few experiences. So he will, when the nervous system is under tension, when we're getting compression and a compromised frame in the horse, we get issues in the nervous system. We have a high-wired horse, so we get anxiety. And those nips and little telling me that he's finding this a little tricky. Normally I'm not yapping like that either. I'm focusing just on him. He needs to tell me that, so it's fine. And it will settle down. And if you have any issues in the behavior of your horse, I can guarantee you there is a physical issue. You're very clever. Well done. Now, come. Oh, really? So we try that one more time. Oh. Good, good. No nipping. Good. And we'll go back. Good, no nipping. No nipping. No nipping. Good. Good boy, come. Good boy. Nice. Good, no. Good walk. Now I didn't like that at all because he's pushing, but I do get a rise of the lumbar, but I don't want it with a compression of the chest like that, so we'll just stop that. Woo. Good boy, nice try. Nice try. There. No, it's fine. It's fine. Good. But sometimes the bad stuff brings in the good stuff, and we get some deep breath. And we'll stick with that for the moment and try it again. Very clever. Very clever. This is a very quick processing horse. So when he looks away to take a moment for himself, he usually comes straight back in. Don't do that. Don't. Now I'm going to try and make that more from a shoulder release. There we go. There, and straighten it. And shoulder. Shoulder release. Good boy. No. Walk backwards. And as you can see, I'm not pulling on the head, even when he's not quite in the frame. Don't push. There. I let him sort it out because it's all just aggravated in the system. So all that kind of behavior is normal for him at the moment, and he's the one in the body, so he needs to tell me how he's feeling and how it's going in there, and also when he's not feeling okay to cope. And it will, yes, you're a very clever boy. It's one of the reasons why we have the halter on and not a cabochon. I really need him to have space to make the yawns, and I also need him to have the opportunity to look for comfort and give a little bit of a push on the upper lip that will help him to stimulate release. He's looking for that in my hand, and so I never just pull my hand away when they're nipping a little bit, or it's not really normal to do that nipping, only on an uncomfortable horse. So I otherwise never have these little bites and marks. It's okay. Yeah. Good boy. Walk. Walk. No, walk. So we're getting a bit stuck in the chest there. Good. Good. There. It's okay. There. There. Good. No, you can do it. Yeah. So I'm just going to move that around a little to see if I can stimulate him to come out of the compression in the chest. Good. No. You're okay. Yeah. And hold. Oh, walk. There you go. Walk. Show up. Show up. No, you can do it. You can. Yeah, clever boy. Clever boy. He's not really a fan at the moment of me having the halter on with the rein underneath. It's a bit distractive for him as he's searching for balance, and I can't quite guide his face directly to give him the pull releases. But I think it's too invasive if I go on the top. We'll give it a little play and see how he goes. Hello. You can tell me. No, there. Good boy. No. There. There. Good. That's better. That's better. Good boy. Hold. Nope. It's okay. There. Good. There. Good. Good job. That's clever. So I am much happier with that. Oh. Oh. Good. That's nice. There. We don't want to make proper piaffe with him in the moment because he's obviously not making proper piaffe. He's just contorting, creating contortions. There, good boy. And I'd rather have something that actually helps him to open the rib cage and to bring the release into the frame rather than hopping on a place. So that's much better for me when we get him softening and listening. And also, again, to discover his own body and what he feels in that moment, find the correct releases. I want him to play within all of the spaces of the chest, bringing the sternum up in between the shoulders, then saying, ooh, that's a lot. I can't quite reach there with my pull. I don't have enough release to hold that up. I don't have enough space in my rib. Go down a little bit, then offset lateral one way or the other and move in between the chest. Growth, and he will start to find those releases much quicker. So work on the mind and the body at the same time. Now he's every day, his whole day in the paddock. He's at this moment still being socialized. Obviously, at this point, we still have a good a thumbs up if we do. Are we happy? Bye. You're so clever. You're very clever. We're going to go and try and make that round that up. Hey, you're being so good. Have we got audio again? Some sound? How come you? Can you hear me at all? I'm never clear about that, but is that to feel his space in the body? I can work on the releases between the shoulder and deep into the chest with the different actions, like a little bit of coordination, a little bit of a position of collection, just because that's what we go here. We have no audio. Okay. So that's our small session with Calippo and bringing some comfort in his body and try and sort out for our next session everything running smoothly, what we can do to reconnect that something